I knew that I had an increased risk of breast cancer. But I walked into my high-risk oncologist and I was just like, you know what? This is not for me. They've got the wrong person. And I immediately walked out. But eventually that inner voice in me said, no, you need to go back. I realized I had not accepted my BRCA mutation. I was still grieving from losing my mother, and that I still had to continue to press forward. And so the second time I went in, I actually did see my doctor. She shared with me my different preventative options, and she was very aggressive. And I remember telling her, I really feel like you're treating me like I have cancer. I don't have cancer. And then she said something to me that really changed and shifted my perspective. She said, Ashley, I have to be aggressive. She said, because you have options. She said, your mother, she didn't have options. And so it was almost like a surrender. I just kind of threw my hands up and I just said, you know what? You're right. Let's explore those options.
Ashley knew that as a carrier of the BRCA2 gene mutation, she was at an increased risk of breast cancer. However, fear, resistance, and grief initially kept her from learning more. Ashley's conversation with her doctor was crucial in helping her account for test results and explore the preventative options available to her. Stories like Ashley's are a valuable tool for talking about hereditary cancer that can benefit both patients and healthcare providers. In this video, I'll explain why. Hi, I'm Dr. Maya Bass. I'm a family physician and a member of the Family Medicine Education Consortium, or FMEC. Welcome to this video in the FMEC's Confidence in Hereditary Cancer discussion series. The series was created with family physicians in mind, although we welcome anyone to join us in learning more about the powerful tool of narrative medicine. If you'd like to learn more about the history and core principles of narrative medicine, I invite you to check out the video, Narrative Medicine Background and Use in Family Medicine, that is a part of this series. In this video, we'll dive a little deeper into how we can use narrative medicine in our care for patients with hereditary cancer risk. Together, we'll explore how stories can be a catalyst for difficult conversations around cancer and how listening to and telling stories has a positive benefit for both patients and providers. Stories are an important tool in the fight against cancer. This is why in 2015, the Center for Disease Control and Prevention launched the Bring Your Brave campaign, which is a rich collection of videos and stories from patients and physicians about hereditary breast and ovarian cancer. The goal of the campaign is to provide information about breast cancer to women below age 45 by telling real stories about young women whose lives have been affected by breast cancer. Through these stories about prevention, risk, family history, and survivorship, Bring Your Brave aims to inspire young women to learn their risk for breast cancer, talk with their healthcare providers about their risk, and live a breast-healthy lifestyle. The campaign also aims to educate healthcare providers on the risk factors for breast cancer before the age of 45, and to help them understand barriers patients face in dealing with hereditary cancer. The stories in the Bring Your Brave campaign are a valuable resource for patients and physicians. For patients, the stories can help drive home the reality that young people can be affected by cancer. Stories can help those who are at risk feel less alone in their struggle, worry, or fear. When they see someone who looks like them or has similar life experiences to them sharing their stories, they are more likely to experience a sense of connection and support. Patients will also learn important information from the stories others are sharing, as well as see desirable behaviors modeled, such as seeking genetic counseling, talking to providers, and talking to family members. The stories in the Bring Your Brave campaign are also valuable learning tools for healthcare providers. Watching patients talk about their personal experiences can help us better understand the issues that our patients face. Learning about how patients deal with certain diagnoses, or about how the many non-clinical factors that impact the way that they may cope with treatment or recovery can improve the ways we approach patient care. And for both patients and physicians, these stories provide a meaningful catalyst for conversations about the risks and treatment of hereditary cancers. Part of our training as providers is to have good communication skills, yet patients frequently complain that their doctors do not listen, appear disinterested, make assumptions, and don't address their concerns. We doctors sometimes say that difficult patients, time pressures, and other factors hamper communication. Narrative medicine can mitigate many of these challenges and strengthen communication between us and our patients. Specifically, Narrative medicine can help patients and physicians find common ground around issues of mortality, the context of their illness, beliefs about disease causality, and shame, blame, and fear. Doctors see illness and death every day. It's part of our jobs. Issues of mortality are not new to us. Patients, however, often experience illness as unexpected. Their past experiences, as well as their fears of death, color their reactions to and interactions about cancer. When thinking about the context of illness, doctors quite naturally view illness as a biological phenomenon requiring medical intervention. Patients view illness with the framework of their entire lives. In terms of causes of disease, patients do not usually have the medical training that doctors have, and so their notions of illness and its causes can differ widely. It can be difficult to connect when doctors and patients have different ideas about why and how an illness is occurring. As a result, care can be compromised. And of course, doctor-patient conversations can be shaped by shame, blame, and fear. Patients may be embarrassed to reveal intimate aspects of themselves, and illness can make them feel vulnerable and fearful. They may be searching for someone to blame, including themselves or even their healthcare providers. It might be equally difficult for doctors to ask questions about intimate aspects of their patients' lives. As providers, we are also sometimes guilty of assigning blame to patients' behaviors or other factors. Shame, blame, and fear on both sides can affect a patient's experience of their illness as well as the care they receive. The challenges I've just mentioned build up barriers to effective conversations between doctors and patients. However, by holding the patient's story as central, narrative medicine can shift our focus from the need to problem solve to the need to understand. As a result, patients are more likely to feel that their needs and concerns are being addressed, and the patient-doctor relationship is strengthened. This can lead to improved health outcomes for patients and, perhaps surprisingly, to improved physician well-being as well. Let's take a closer look at the benefits of narrative medicine for physicians. Then we'll look at the benefits for patients. To do this, we'll turn to findings from the Bring Your Brave campaign. In 2023, the FMEC worked with faculty and residents at 9 family medicine residency training programs to share the Bring Your Brave materials. 100% of the leaders of these family medicine residency programs believe that these materials will have a positive impact on family medicine providers by achieving one or more of the following: increasing provider knowledge and comfort with the topic of cancer, increasing provider empathy through greater insight into the patient experience, and/or increasing provider motivation as a result of learning from other physicians' experiences. Hearing other healthcare providers share their experiences of discussing cancer risks with their patients is educational and can build our own sense of confidence in having similar discussions with our patients. For example, after watching the video Shira on pointing patients in the right direction, in which a physician assistant describes her efforts to encourage different types of patients to meet with genetic counselors and to take control of their own health, a family physician reflected, "This video highlights our roles as clinicians to be sure we don't overlook family history and that we make sure to offer our patients all the available resources like speaking with a genetic counselor." After watching the video Dr. Alter on asking the next question, in which an oncologist shares how important it is to really engage with the patient when taking a history in order to uncover as much of their story as you can, another family physician said, "An incredibly powerful patient case shared by Dr. Alter, where digging deeper into the family history of cancer led to massive ripple effects and potentially saved numerous lives in one family. This encourages me as a primary care doctor in training to always take a few extra moments in my visit with a patient to ask these important questions." In addition to improving our interactions with and care for patients, I want to highlight how narrative medicine can play an important role in physician self-care. Burnout is a very serious issue for providers. In a 2023 white paper, the American Academy of Family Physicians stated that it strongly believes that physician burnout is a health system, organization, practice, and physician culture problem, not just an individual concern. Family physicians reported a 51% burnout rate in 2022, which is significantly higher than the rate among many other specialties. Providing tools to reduce burnout and to better support medical professionals is critical. As the industry struggles to create sustainable interventions to fight burnout at the system and practice level, individuals must also work to develop their self-care practices to defend against stress and exhaustion. Positive outcomes are being found through narrative medicine. For example, researchers are finding that physicians who develop narrative competence are better positioned to fight burnout and develop skills to cope with the emotional strain of daily practice. Dr. Rita Sharon, who introduced the modern concept of narrative medicine over 20 years ago, wrote in a 2019 article in Neurology Today, "No one was talking about clinician burnout at the time. And as narrative medicine programs began to spread across the country, some physicians trained in this principle began to see how it can protect clinicians from feeling a sense of depersonalization and other symptoms of burnout. By reflecting on our challenges and supporting or finding support from our colleagues, we help to reduce our own feelings of isolation and actively develop skills for personal strength and resilience." So to summarize, narrative medicine can make us better doctors by allowing us to see, hear, and feel different perspectives that help us better connect with patients. Narrative medicine can also help us take care of ourselves by allowing us to connect to our feelings and the support of colleagues. Another great resource, in addition to the Bring Your Brave materials, are stories from the website Story Center. I encourage you to watch one or more of the videos from that section titled Conversations About Hereditary Breast and Ovarian Cancer Saves Lives website. Their healthcare provider stories can help you learn from your colleagues' experience and reflect on your own practices. The site also has an instructional guide for healthcare providers, which offers discussion questions and additional resources for educating patients about genetic testing. Now let's take a closer look at how narrative medicine benefits patients by providing education and emotional support. The power of first-person narratives combined with visually dynamic presentations lend themselves to larger audience with varying degrees of literacy and education levels. This allows more patients to access information, develop an understanding of complex medical issues, and find camaraderie, solace, and at times, inspiration by hearing the stories of others. Let's look at some of the resources on the Bring Your Brave website that can help patients confront their risk and develop the courage and skills they need to have difficult conversations with family members and loved ones. After watching the video, Brianna's Family History of Breast Cancer, Accepting Support, in which a young patient shares how opening up about her high-risk status helped her get much-needed support from others, a primary care physician shared, "This story absolutely resonates as someone with a history of breast cancer in my family and also a personality that makes it difficult to allow others into my struggles and accept support. It's an important lesson for all of us that accepting support and being vulnerable can be one of the best decisions you can make during tough and scary situations." After watching the video Arnaldo and Vanessa's family history, Facing Breast Cancer Together, in which a father and daughter talk about their shared history with breast cancer treatment, a family medicine provider commented, "This was a great story that addressed the misconception that men cannot get breast cancer, but also addressed the guilt that a parent can feel passing on the genetic risk to the children." Showing these and other videos to your patients can be instrumental in helping them take the next step in processing and addressing their journey with hereditary cancer. Here are 2 concrete steps you can take to use the CDC's Bring Your Brave campaign and other stories into your own practice. First, take the time to view the stories of physicians and patients dealing with hereditary cancer risk and encourage your care team to do the same. Second, decide how you're going to communicate Bring Your Brave resources to your patients. Taking the time to view the stories of physicians and patients dealing with hereditary cancer risk will prepare you and your care team to broach the difficult subject of cancer with your patients, equip you with the emotional and practical tools to navigate conversations with tact and care, and help you develop the confidence and compassion needed to discuss options and critical information. Of course, even with this preparation and knowledge, you are still limited in the amount of time you have with your patients to gather information, explain the importance of screening, interpret results, etc. This is another reason why the Bring Your Brave resources are so valuable, since patients can access them on their own. Some ideas of ways to share Bring Your Brave materials with patients include a pre-appointment survey, a tablet you keep in the waiting room so patients can watch the videos, a note in the after-visit summary that includes a link to the Bring Your Brave website, or something that gets covered in a follow-up visit. The stories and information from the Bring Your Brave campaign can empower your patients by helping them develop a better understanding of the disease itself and their risk and treatment options. The materials can also help patients find a sense of community and support beyond your office. I hope this video has helped you see numerous ways narrative medicine can be a powerful tool for patient care as well as physician self-care. And I hope you enjoyed learning more about the Bring Your Brave campaign. I encourage you to check out the stories I recommended, as well as explore the other resources available on the site. Thank you for joining the Family Medicine Education Consortium to learn about narrative medicine as a tool to support patients with hereditary cancer risk. And be sure to check out our additional videos that are part of this Confidence in Hereditary Cancer discussion series.